Under this, this includes your employees, funders, and contractors. Now, why is it important? Jonas and Rosenberg identified 4 reasons why we should pursue quality care. Number 1 is the first principle of the Hippocratic Oath. Did you remember that? Primum non nocere, or your first do no harm. Second thing is humanitarian motivation to use resources for the good of those in need. Third one, professionalism. And the last one is survival. So ito yung international context. But it's more fun in the Philippines. So in the local setting, we have other reasons. Although similar to the international reasons, we have several reasons, like for example, number 1, tougher competition. Here in the Philippines, for the organization to survive the competition of getting a greater consumer market share, they should commit themselves to quality improvement and patient satisfaction. So that is the first reason in the Philippines. Second one is frequent medical errors. Although we nurses or doctors and other healthcare professionals are trained to be efficient even under stress, we are still humans. And to be human, we are not immune to errors, right?
Right.
Because in reality, we're not error-proof. Nobody here is perfect, right? So that's why we need quality care, frequent medical errors. Rising costs and limited expenditure. Nowadays, healthcare has been highly dependent on new and expensive technologies. Both consumers and the healthcare providers equate high-quality care with expensive care. Even health insurances encourage the patient to pursue high-quality care or expensive care because it has been paid for them. Fourth one is the rising demand and limited health resources. Our generation is, aminin na natin, tayo po ay health conscious. So being a health conscious generation, we have an increased demand, but still we have limited resources. So the demand is greater than the resources. Fifth reason is the conservative variation in healthcare outcomes and cost. Medical decision making is influenced by experience and many other factors. So this in turn can cause unnecessary cost because of the practice which is not evidence-based or not standardized. Now, quality healthcare begins with 2 principal actions. Quality healthcare begins with selection of the most appropriate health intervention, and number 2, effective, efficient, timely implementation of intervention. Now, to put it in simple terms, quality healthcare starts with a good decision and a good performance. That good decision should be followed by a good performance, always. Now, how do you know if you're making the good decisions and you're performing good actions? How do you know? You assess health using the Donabedian model. Sabi nga sa Donabedian model, you have to assess 3 components. So what are the 3 components? Let's review. The structural component. Number 2 is the process and your outcome component. Right? Okay, so kapag sinabi mong structural component, my dear friends, you're talking of, reviewin lang natin yung sinabi niyan kaya kanina para mas matanim. Ayan. Structural, you're talking of manpower and the materials. Manpower, for example, the number and capability of the medical staff. Material will include your diagnostic and treatment facilities. Process, you're talking of medical and non-medical process. Example of medical process, treatment care, nursing care. Non-medical process, visiting hours, food provision. And outcome, ito may kinalaman sa patient. Sabi nga ni ma'am, this should be our focus. This is the biopsychosocial spiritual effect of the care to your patient. So that is what you assess. So, how do we say that quality care or care is good enough? Or care has quality? Care is good enough if it meets a set criteria. So, kung check ka sa lahat ng criteria, it means pasado ka sa quality, right? But passing the standards is not enough. we need to pursue improvement. Now, the next slide that I will discuss will talk about the 4 levels of improvement, which will include quality control, quality assurance, quality improvement, and total quality management. The first thing, the lowest level, is quality control. So let's discuss quality control. Talk about this. This is the inspection of finished product at the detection of deviation. Here, you have to consider these words. Inspection of finished products to detect deviation. So here, with quality control, hihintayin mo munang matapos yung produkto. Kaya pala, these things are derived from manufacturing companies. In-apply lang natin sa healthcare. Okay? So here, with quality control, hintayin mo munang matapos yung sapatos.
We are always late. We are always late. We are the last to implement any improvements, any innovations. Okay.
Dito sa quality control, hintayin mo munang matapos yung sapatos na gawa na. Tsaka mo palang titignan kung balbol ba yung pagkakagawa o mali ba yung balat na nilagay. So, if you detect an error or defect on the said finished product, you either put it back to be reworked by the worker or you discard it, which made this process expensive and wasteful. So, hindi maganda. For example, this can be applied to healthcare. For example, sa OR. Quality control will not guarantee quality. For example, na-amputate na yung knee. Tapos siya mo palang i-inspect. Eh, kaliwa pala dapat na yung tinanggal. Wala ka rin magagawa. So it's not a thing of healthcare. Right? Okay. And with this, since it is expensive and wasteful, they consulted Edwards Deming. And his idea is this. All processes are vulnerable to loss of quality due to variation. So kaya lang daw tayo nagkakamali, according to Deming, because of variance. The process varies, so that increases the likelihood of errors. To put it in simple terms, and for you to remember it, use this thing that I worked on. Variation equals error. So kapag madaming variation, madaming error. So if you reduce variation, you reduce errors, right? Okay. So this idea gave birth to quality assurance. Quality assurance, with this, you reduce the variance, prescribing a set of preventive activities to ensure quality of the finished product. The goal of quality assurance is this: control variability through standardization. So with quality assurance, you prescribe a standard. Standard means this. It is a set of statements of expectations for the inputs, process behaviors, and outcome of health systems. In other words, for you to do a thing, there is an expected behavior to you for you to be able to do that certain process or thing. So it's a standard. May pagkakapare-pareho. Hi, good evening. You're late. Now, quality assurance gave birth to quality improvement, which includes your practice guidelines, clinical pathways, medical chart audits, and utilization reviews. Now, let's talk about the highest level of quality improvement, which is your quality management. My dear friends, quality management is organization-wide pursuit of quality. From the name itself, quality management, quality starts with the management, right?
Yes.
Okay. So if this involves the internal customers, for example, the staff and the owner or stockholder of the hospital, external customers, which include the payors, for example, field health, the patient, and other things such as contractors. If this quality management involves these two, then it is termed as quality management. When you talk about total quality management, from top to bottom, from the upper management to the lowest employee is involved in the pursuit of quality. So that is total quality management. Those are the 4 levels: quality control, assurance, improvement, and quality management. One more thing. quality management, total quality management, or yung TQM as term, uses the Swiss cheese model by James Reason. This is a good model. I'll explain it later. This is a good model because it rejects the blame culture. Sisihan. Walang sisihan dito. Because according to the Swiss cheese model, errors are not because of a single event or a person. But errors occur due to holes or glitches in the system. This is how a Swiss cheese looks like. Wait, I'll give you an illustration of how this works, this model. Can you hold this? Right. This is one system. For example, the nursing department. The process or the system has holes or glitches in the process. Yeah. For example, this is the laboratory department. Their process has holes or glitches. And this is, what's this? Medicine, for example. Now, for an error to occur, the holes, can I borrow your ball pen? Sorry. For the error to occur, the holes must align each other para matubog siya ng error. So, hindi lang isang department ang may kasalanan. Hindi lang tao. Lahat ng system may kasalanan. Sorry. Sorry for that, sir. I'm a bit shaky because of Parkinson's disease. So that is a Swiss cheese model. Errors are not because of one person, one single department. Errors happen because of the whole system. You should not blame. That's my report. Thank you very much.